Central Ohio Primary Care has started charging patients for certain MyChart messages. It represents more than 300 physicians with more than 57 locations across the state, but it is important to know it's not charging for all messages. 10 TV's Bryn Caswell takes a deeper look at how your wallet might be impacted.
Institutions like The Ohio State University and the Cleveland Clinic have been charging patients for certain MyChart messages for years. Now other networks like Central Ohio Primary Care says it's necessary, citing the growing number of hours their physicians are spending a day chatting with their patients online. 65,000. That's how many messages medical group Central Ohio Primary Care received a month from patients. That's about 16,000 messages a week. Care, which CMO Victor Legner says is no longer entirely free.
What went into it is we're looking for ways that we can better improve our primary care that we deliver to our patients. That's our top priority.
COPC is now charging patients for messages that classify as e-visits or messages that require significant clinical advice. Legner says that's less than 1% of messages received.
If you ask for a prescription refill or a simple message, we wouldn't consider that.
Ohio State began billing for in-depth MyChart messages in 2020. Cleveland Clinic followed in 2022. Both say only a small number of patients are affected. The Ohio Hospital Association says more hospitals are doing it, as doctors often aren't paid for time spent messaging patients.
So you're still receiving a charge that you would have received before if you came into the office or we did telehealth, but we're changing it to try to make it more convenient.
While the cost varies depending on insurance, Legner says think of the payment as another copay. It comes as the American Medical Association reports U.S. healthcare spending jumped 7.5% in 2023, reaching $4.9 trillion.
We're seeing healthcare costs rise, but we want that to happen because putting in the investment to keep somebody healthy is worth it to prevent chronic disease in the future.
Ohio Health, Nationwide Children's, and Carmel Health do not charge patients for MyChart messages. Hospitals recommend always consulting with your insurance company before using MyChart. Reporting in Westerville, Bryn Caswell, 10 TV News.